This slide, we are going to discuss HIV/AIDS from the perspective of the patient-family educator. The role is to educate patients and their families regarding the requirements and responsibilities in caring for themselves and/or their family members with HIV/AIDS. As a patient-family educator, we have goals, outcomes, and how to evaluate if the education session was effective. For goals, we want to know, what does the patient-family educator hope to accomplish during the education session? Which pertinent issues should be addressed? Therefore, by the end of the education session, we can say the patient and their families will be able to identify infection prevention measures, as well as recognize which clinical manifestations require further medical evaluation. Outcomes. Did the patient and or the family comprehend what was discussed? Were their questions answered? So for this, we want to be sure that the patient and or family understands the importance of initiating and completing the necessary treatments for HIV/AIDS and its clinical manifestations. In order to evaluate if the education session was effective, what I would use is a teach-back method. We want to be sure that the patient and or the family can reiterate what was being taught during the education session, such as when clinical manifestations worsen, what to do if there are stressors at home, what to do to make sure they have illness and family balance. All of those are important to make sure the patient is okay when caring for themselves and or their loved ones at home. We can also provide during all this, for goals, outcomes, and evaluation, a resource list. This resource list would be given to the patient and or the family to provide them with a list to effectively manage and care for themselves and their loved ones at home. That is essential once home, that the patient has a hand in caring for themselves and making sure that they're okay until their next appointment.